But I want to tell you, it is really not just New York. The U.S. Conference of Mayors tonight released a survey of mayors in 213 U.S. cities over 41 states. Nearly 90% of the mayors said they already lack sufficient test kits and face masks and other protective equipment for not just medical workers, but also emergency responders. 85% of mayors said their hospitals do not have enough ventilators. The governor in the great state of Colorado, Jared Polis, tonight gave a briefing on that state's stay-at-home order, saying that so far in Colorado, on average, each infected person is infecting 3 to 4 other people, which is a considerably higher infection rate than it was in China when China was at its worst. Governor Polis saying tonight that Colorado has 900 ventilators, and they believe they will need 7,000. Here's one other report tonight from Southwest Georgia, not from Atlanta, but from rural Southwest Georgia, Albany, Georgia, where the nearest interstate is 40 miles east. And there's no reason for local officials to blame it on New York City or blame it on China or blame it on any other boogeyman foreign influence. Quote, the area's lone hospital network, Phoebe Putney's at the center of the coronavirus storm. The sudden deluge of critically ill patients quickly overwhelmed Albany's main hospital. When reports of the virus first came out of China late last year, Phoebe's CEO said the hospital tried to prepare by building up a 6-month store of supplies. The hospital burned through that 6-month stockpile in 7 days when the virus hit their hospital, he said. Quote, what we were not prepared for was the sheer numbers. On Wednesday of this week, the hospital in Albany, Georgia, announced that all 38 of its intensive care beds for coronavirus patients were full. The following day, after 5 other hospitals agreed to take transfers, Phoebe had only 1 bed open. Meanwhile, Phoebe is working to set up overflow units at a mostly empty branch hospital about 1.5 miles away. But to staff those units, the hospital CEO says he's going to need about 50 to 75 more nurses, along with more nurse assistants and respiratory therapists and doctors. He has turned to the Georgia governor's office and the Department of Public Health to please try to find those workers. He also needs workers now to backfill for staffers at that hospital who have already fallen ill. So far, at least 18 workers at that one rural Georgia hospital have tested positive for COVID-19. Unable to find replacements to help, has told hospital workers that they must report for duty, even if they have tested positive. That's not New York City. That's not King County, Seattle, Washington. That's not even New Orleans, which is 400 miles away from there. That's rural Black Belt, Georgia. This is a national crisis. This is not the kind of crisis that each state can fix on their own or each town or each hospital can approach on their own. This is a national thing, which would make it wonderful if we had national leadership and a national response. But we don't. So we do what we can.